This patient is referred to me for endodontic treatment of tooth number 29. So as you can see, old amalgam restoration that's loose because of this large, you can see large cavity. And you can see a periapical lucency also associated with the tooth. So I need you guys' opinion. I need you to tell me if this tooth is salvageable. If we can salvage this tooth and clean out the decay. Looks like there's not much tooth left here, and you can see a periapical lucency. So let me know in the comments if you would try to save this tooth, root canal, and then maybe the dentist can build it up and crown it. Hopefully this will go away, the infection will go away. Let me know. So this is the case. I wanted you guys' opinion, and some people were asking, oh, show us a bite wing. Okay, so here's the bite wing. I thought that PA was pretty self-explanatory, but here's the bite wing. Some people were asking, what's the probing? If there was more than usual probing, abnormal probing, I would have mentioned it. So probings were all within normal limits, 1 to 3 millimeters. This is the bite wing. I don't have a CBCD. Don't ask for a CBCD of this. I showed you guys a PA and I asked what do you think? What's your opinion? Is this tooth salvageable? Root canal, or should we go ahead and extract the tooth? You guys made it so complicated. Here, I showed you the bite wing, periapical lucency, decay. So here it is. I showed you the bite wing. I showed you the PA probings within normal limits, 1 to 3 millimeters. Decay here, periapical lucency there. Percussion tender, palpation tender. So tell me what to do with this tooth. Is this tooth, would you extract it? Would you try to save the tooth? Would you extract it? Would you do a root canal, clean out the decay, do a root canal? Whatever. I don't know. Some people use post or what have you. Post, build up, crown, or is this tooth one of those teeth that you think that you should just go ahead and extract? I just wanted your opinion. Give me your opinion. This patient was referred to me 7 years, 2 months ago. 7 years, 2 months. Let's round it down and say 7 years ago. So this patient was referred to me 7 years ago for endodontic treatment of tooth number 29. As you can see, large subgingival decay. This amalgam was wedged in between number 29 and 30. It was loose and wedged in. And you can see a periapical lucency here, of course. And here's the date. As you can see, 7 years, 2 months ago. So let's round it down to 7 years ago when this patient was referred to me. Put this question to you guys. What would you do with this tooth? Would you go ahead and try to save it or extract it? Here's the bite wing some of you guys wanted to see. And my question was, what would you do? Would you try to save it or would you extract it? And the majority of you said extract. The majority of you said this tooth is gone. the decay is too severe, too substantial. There's a periapical lucency, and this tooth is a goner. Go ahead and extract it and put a dental implant there. Well, I wouldn't do it. I'm an endodontist, so basically refer the patient back. If it was you, you would refer the patient back, or if it was you as a general dentist, you would just extract the tooth and put a dental implant or do a 3-unit bridge. Most of you said that. I discussed options with the patient. I discussed that option also, extraction. Went over options with the patient, tried to see if it can save the tooth with guarded prognosis or go ahead and extract the tooth. And patient chose to try to save the tooth. Again, that was 7 years, 2 months ago. Let's round it down to 7 years ago. And here's the date. This is immediately after I did the root canal. So cleaned out the decay and did the root canal. Again, you can see the periapical lucency here. And you can see how much tooth structure remains right there. So this is immediately after I did the root canal, 7 years, 2 months ago. And let's round it down to 7 years ago. And here's the date, as you can see, 5/11/2016. And this was yesterday. 7 years, 2 months. Again, let's round it down to 7 years. 7 years post-op of tooth number 29. As you can see, tooth is doing beautifully. The periapical lucency is healed completely. Tooth is in full function, and patient is extremely happy. And here's the date. As you can see, 7 years, 2 months post-op of tooth number 29, and tooth is doing beautifully. So to those who said go ahead and extract the tooth and do an implant or a 3-unit bridge, you need to give teeth more chance. You know, teeth are pretty resilient, and in the hands of a good endodontist and a good general dentist, you know, you can do wonders for a patient. This tooth has survived for 7 years, 2 months. Has survived for 7 years and 2 months now. Again, let's round it down to 7 years. 7 years now. And I'm optimistic that she's going to have it in her mouth for a very, very, very long time. Because as you can see, it's perfect. Perfect. No issues, no problems with it. As I said, the periapical lucency is healed. The endo took care of that. And this dentist did a fantastic job restoring this tooth. Looks like a prefab metal post, built it up, put a crown on it. It's beautiful. 7 years, 2 months post-op of tooth number 29. So don't just be so rash and say, okay, I'm gonna extract the tooth. Give teeth a chance in the hands of a good dentist and good general dentist, good general practitioner. Teeth can last, teeth can be saved and survive a long time, As you can see, that's the date.